evening. It is Thursday, October 24th. This is the North Andover Board of Health meeting. I officially call the meeting to order. We will start with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Next on our agenda is the approval of meeting minutes from July 25th, 2024 and August 22nd, 2024.
I reviewed both sets of minutes and make a motion to approve.
I second.
All those in favor?
Aye.
Aye.
Minutes from July 25th and August 22nd, 2024 are approved. Next on the agenda is communications, announcements, and discussions, and we will start with a tobacco control update. Brian, did you want to start with that?
Sure. Ron Beauregard, our tobacco control agent, who's been with the town for, what, 20 years now?
1999.
So 25 years? Good job, all right. Just wants to go over some potential updates. Our last revision was in 2019. Took effect January 2020. The state has since changed the overall state law, so our fines don't match up anymore. There's some more restrictions, things like that. So Ron just wants to go through, give you guys a brief update as to the changes that have happened in the past and how we can be more in line with the state, and any case law that's coming around down the pipe with Cumberland Farms and some of the other things with the Next Generation Tobacco Free movement. If you want to touch upon that, that would be great, and we can go from there. So come on up to the mic.
Well, thank you very much for having me. It's always a pleasure to work with North Andover. You're one of the 6 originals. We started the program. Well, I didn't start the program. Someone prior to me, Diane Pickles.
Diane
I remember
Pickles.
him.
Diane.
Diane. Yes. Yeah.
She was knight for us, right?
Mm-hmm.
Yeah.
So we had the 6 original with Andover and North Andover. We've now expanded to 18. Wish we had a little more staff, but that's all right. All right, I'm not going to complain. So yes, as Brian had said, the strictest state law in the country was enacted by the legislature, and the regulations rolled out in June of 2020. The highlights of it, of course, are the no more flavored tobacco, with the narrow exception of smoking bars, of which there's about a dozen throughout the state. And I think another one that doesn't get quite as much light shined on it is the regulation that says that you have to ID everyone. Here in our collaborative, we moved it from 27 to 40, including North Andover, but the state surprised us and said ID everyone. Before I mention these, to go through the details, I sent you these speed reading documents here. It's only meant for your edification later on. I'm going to go through it quite quickly if you want me to slow down or stop somewhere, but some of it's just very technical sort of amendments, but it's to just freshen up the regs, and I wanted to be sure it was thorough and let you know exactly what it is that's going in. That's why this not one-sheeter, but 3-sheeter or something is going to show you that. At this stage of my work with this program, there have been many policies thrown out to help in matters in regards to youth access and helping adults quit. I've expressed to the state, we get together regularly, and I got together with fellow boards of health programs. There's about 15 of them, I believe, maybe 16 in the state. Some of them just one city, like a Boston, Springfield, and others with collaboratives like ours. And, we're always trying to think of ways to improve, even improve upon what's been improved. My sales rates, when I do the compliance checks, affectionately known as stings, which is fine, that's what I call them when I go talk with the retailers, is around 5 or 6, sometimes 7%. And I've been always told, that's great, that's an A. You're getting 95, 94%, but it doesn't feel like an A to me. It really doesn't. It certainly doesn't feel like an A to someone receiving the correction order for $1,000. And I always thought when I started the job that you know, after a few years, I'd get accustomed to giving someone a fine, and that was even back with $100, $200, $300 fine. I'm not. I really am not. It's not something I relish at all. It's maybe because I spend so much time building relationships with the retailers, and also knowing that with anything in life, a broad brush is not what you should have in your hand. And I think many of the hard-working retailers sometimes get the backside of that broad brush. I don't like that. I think most of them are honest, trying to operate a legitimate business. And yes, it just so happens to have tobacco on the menu. If there were many convenience stores that didn't sell tobacco products, I'd say, hey, why aren't you doing like what half of the folks are doing? That's just not the way it's working right now. We hope to have a sunset provision. You mentioned a policy that has been, you know, kind of front page news, or at least close. I know the Globe has featured it, which is a nicotine-free generation. This here was a huge decision made by the Massachusetts Supreme Judicial Court. I must say, before that decision was made, supporting and affirming that it was within the constitutional confines of Massachusetts to put a definite date upon which you would be 21. It would be as if North Andover were to adopt something tonight and say, as of January 1st, 2025, if you're 21, then anyone in town can sell to you as 21. Anyone that becomes 21 after that date will never be able to buy tobacco products. So that's the gist of it. New Zealand had it for some time, meaning I don't believe it was rolled out, but they had approved it, and then I think there was perhaps a change in government, if I recall. There's a couple of communities, perhaps more than that, but Malibu comes to mind, and Manhattan Beach, I believe. Those were early comers onto this. They kind of got things rolling. And here in, there's no state that's adopted it. To my I can't tell you for sure if a country has, but perhaps the countries that, if they have rolled it out, might not be as similar to our form of government here in the United States. However, there are states, there are communities following Brookline's lead once the Supreme Judicial Court approved it, that have approved it. I'm guessing the number is somewhere around 8, 9, 10, and with others, you know, moving on it as well. You know, we always bounce around ideas at the meetings. In the meeting that I went to a couple weeks ago, I make it a point to listen to the retailers, and I try to figure out what is the end game here, what can make it a win-win. And I have to say, when the thing I mentioned to you about the ID, everyone, the way it's written in the 105 CMR 665, and now in your local regs, if you amend it as such, it's a little legalese, surprise, surprise. You know, sometimes things aren't just quite as straightforward as you like them to be. So there was a little moment there when we were trying to figure it all out when it got rolled out as to whether or not that really meant, as we call the Fenway rule, you have to ID everyone. And it took a little while, and then they finally said, yeah, Ron, that's what it means. And I was probably the loudest about trying to figure that one out. So I put together the signs, which I'm sure I showed you, that I sent to the retailers. You know, it's not, we have 5 signs that are required by the state law, but I put this one together, and I must say that the retailers use it. It's a tool. It's not just something that becomes a wallpaper. Or they use it because they can point to it and say, ah, shucks, I have to do this. And by the way, look at the camera. You know, give me a break. I'm just doing my job. Despite that, we still have that 5, 6, 7% sales rate. So what I've been bouncing around the idea with retailers is, how do we make this work? And I met a retailer in Westford, and sometimes I look at their systems, their cash register systems, which are really now computers, and almost all of them have a system where they have to scan the product, and then the clerk is prompted to ask for an ID. To either put in the date of birth, or there's a button oftentimes to override it. Human error is by far the reason for the correction orders being issued on this. There are few exceptions with an owner just making that decision on their own. But I saw an owner, and I'm sorry I'm going, I know I'll get to the rig. You asked me, Brian, to give you a quick overview, so it's not quite as quick maybe as I should be. That he showed me a system. I happened to go in there and he showed it to me. So, all of them, you do the barcode on the tobacco product. And then the magic happened on that screen, which was something I had never seen before, which was, there's no way out. You need to scan an ID, period. You can't scan the ID, you're not going through with the sale. I asked the owner, I says, wow, when did you set this up? He said, I've had this a couple of years. He told me what it costs for the registers. He told me what the scanners cost. He told me about what the monthly fee was to make sure that there was a staff of tech support to be able to help him out if anything went wrong, awry, because he sold beer and wine as well. And he said to me two things. I said, well, why are the other ones set up different? Because I look at them and they can do the bypass. And he says, Ron, it's all in the privileges. What are you talking about, Mike? And he said, it's all about how it's set up. He says, most of them can be set up that way, but it's chosen not to be done. The main reason why it's chosen not to be done makes a lot of sense as I talk to the retailers, and that is not to get somebody ticked off and not go to their particular store, because if the other guy down the street is doing it, not doing it, then the business might go elsewhere. I have had actually a few retailers who have said to me, why aren't you checking? Aren't you sending in people that are 30? Because we ID everyone, but they don't ID them over there. And I've heard this from a couple of liquor store owners. They're kind of disgruntled about it. And I'm honest with them. I tell them I don't do that. I personally don't have a great appetite to fine someone for not IDing a 35-year-old or something. Certainly don't have an appetite to send in someone my age, and as long as these systems aren't in place. I wish I could set something up where I give a warning. We would get the sale and just kind of go in and say, this one's okay, but you gotta ID everyone. With people, again, in that, say, 20s, 30s. In any event, the other thing he said to me that was big for me was, he said, Ron, I can sleep at night. He says, I never have to worry about a sale of beer and wine and tobacco. And so I was sold on it. I'm trying to pitch it as an idea to, I think, be directly related to what our program is about, is to not allow sales to the people most vulnerable and that hold on to the habit, addiction. All right, so that's it. I think there'll be, and I'll just say on the nicotine-free generation as well as other policies, I've heard very knowledgeable, intelligent, knowledgeable, well-meaning folks who are for that program, for that policy, and I've also talked to folks who are just as talented and just as smart, and they don't think it's the right way to go. So it's going to be on our kind of on the front burner now here in terms of hearing about that policy, and it'll be up to everyone to make their judgment. If you have any questions about it, I'll be more than happy to answer them. The only question that I had that I'm still looking for answers for is, most of the time, since in my 20-plus years, we always look for policy that is evidence-based, has strong support from our epidemiological team. I know that the Mass Tobacco Control Program does not view this as a priority policy, and I've reached out for data, and as of right now, in fairness, there's not really any support on the epidemiological level on it, but it is a novel idea, so it might not just have the traction yet to know until you get it. Yes?
One inquiry, how much of a difference between the system that you have a preference for and what someone might otherwise buy? Since it sounds like you talked to the guy a little bit.
Yeah. He was so great that he allowed me to speak with his vendor, who sets them up. I don't have a lot of technical know-how, but I suspect, just based on my conversations with retailers, that there is a way to switch most of the systems that are already in place for that kind of a strict scan.
So it's like nominally an hour or so, some kind of programming time.
Some kind of programming time. And then the other thing I wanted to mention, the downside, and I'm mentioning it as a downside because it's been, I've been criticized for it. And my view is, they'll say it's not, there's going to be, they know of, and this isn't from the retailers, it's predominantly from just others that I talk with. They say, well, it'll let some bad IDs in. I said, okay. I think that's probably true of humans too, all right? So I'm going to take my bet on the machine in this case. I've heard and I've confirmed now, we have a research intern, and she looked at some research for me, and I haven't read it yet, but I was quite certain, but I kept being told that if someone didn't have a driver's license, then the mass ID wouldn't be sufficient. You couldn't scan that. But I believe that's not true. It doesn't seem to make any logical sense for that not to be true, because that's what it's used for in many cases, for it to be scanned. And then the other thing that I've gotten a little pushback from some retailers is that it would hurt I never knew this existed, but passport customers. Yeah, you can't scan a passport. Now, anyone that knows me in the tobacco control circles probably regard me as a little bit, perhaps let's say moderate or easier on enforcement and focusing a little more on education. And then this one here, I'm very friendly to the retailer, but I just say that's going to be one of the tough luck things, I mean, at some point, it's important to the business, but I've never gotten anyone telling me that it's certainly more than 1% of their business. It depends on the store and the time of the day and where it's located, near an airport, near a highway, blah, blah, blah. But I just would say that would have to be just the pain, the penalty, I guess, of having such a system. All right, I'm going to fly through these, I promise you. I'm going to just go right through them. What I've given you is the regulations that Brian had mentioned that are in effect right now with North Andover. You did that right before, the year before, the state changed it to 105 CMR 665. So those are the three documents, the amendments, your local regs, and the state regs. The first one, I can fly through them because it can be boring, all right? But I just want you to know what's in front of you. The first is adding the definition of a coupon. Your regulations do address coupons, which I'll also talk about a little further after the definition section. But basically, the key to this definition of coupon is a very interesting one. I've gone through quite a lot of training in regards to how coupons are treated. And just suffice it to say, if you see a sign on a store front or inside, anywhere, that says, if you buy 2 of this product, you get it at a special price, or, buy 1, get the other one lower, anything like that, interestingly, that sign is a coupon. The sign is a coupon. It took me a while at my age to know that, coupons aren't things you snip out and, a piece of paper. They're now on your phone, and now they're in a sign. And so that's why the words in there are a statement or any communication distributed for. The next one is just simply, sounds very long and all that, but basically it just substitutes your definition of electronic cigarette to the state's definition of all vaping products and accessories, which is electronic nicotine delivery system. And that's just to be consistent with 105 CMR 665. Self-service display, I remember there was a minor difference between yours and the state's, but I don't think you'll find objection to the state's definition of just any display that's accessible to customers. And I did take out the vending machine. There was a vending machine exception, but you've already gotten rid of vending machines, so we just kind of tidy that up. The smoking bar definition you had in your regs was very good, but I just thought it might as well just mirror the state's definition. Goes into a little more detail of what it is. Tobacco product, I just replaced that definition as well. That will mirror 105 CMR 665. And a very important thing in that definition, kind of 1, 2, 3, 4, 5 lines into that lengthy definition of what a tobacco product is the term electronic nicotine delivery system, which I just mentioned earlier. The fact that an electronic nicotine delivery system is the same as a tobacco product, and that gets tricky because an electronic nicotine delivery system means the aerosolization or vaporization of any substance. So it's the one that at first got many of the retailers understandably confused because we were literally saying if you had a flavored vape and it was flavored, but it was only CBD, that is a tobacco product. It's kind of weird, but it is. That's kind of the way the law reads. But a CBD vape is a tobacco product because it is an electronic nicotine delivery device. It's using any substance, in this case CBD, so we call it a tobacco product. What else here? Vaping products, again, I just switched that in one of your sections in regards to just calling electronic nicotine delivery system. Section 3, you tried to do something very tidy at some point. Remember Brian, we tried to get them all on one. Yeah, I didn't bring them all, but some of the signs are more effective, I think, than others. I think the best sign of the 5 that are required is the one that gives you the 1-800 number to quit. That is meaningful. The other ones, it's getting hard for me to read them, especially from a distance. And then this 3.3 is what we were just mentioning about IDing everybody. Yeah, that's IDing everyone. Face-to-face sales, define, delete, face. Oh, yeah, I just took out the vending machine exception. It's no longer necessary in that. Tobacco product sales permit. That one is something that's optional for you, but it's come in handy. Fortunately, not on many cases, but when someone's kind of being a little stubborn, not paying a fine or serving a suspension, it won't allow a renewal of the permit unless those penalties, if they're outstanding, and so they must be satisfied. So you want to really kind of, that one's less technical and more of an option for you to deal with. Okay, and then this one here, I guess, Brian reminded me that I perhaps already mentioned this one. I thought today was going to be the first, but you have to, I don't mean to ever confuse North Andover with North Reading or any of the other communities, but I sometimes do, and so when I was putting this together, I didn't know what I had presented maybe and what I didn't. But this is the attrition clause, which has become popular. It does have some epidemiological support. And as I'm up here talking, I'm remembering, I remember I told you that it was a correlation, not necessarily a causation, but your neighbor in Andover has it, Newburyport that I work with has it, Westford has it, and several. I have a sheet here that has about 50 communities that has that provision. So I recommend you consider it. It would be even strengthening your laws even more, and just thinking off the cuff, there are businesses that can come in that don't sell tobacco, and liquor stores comes to mind. I know we have at least one liquor store in Andover. They probably wanted to sell cigars or something like that, but they don't, and they're, from everything I see, they're very successful. So, and then the sale of blunt wraps. Let's see. Strike the word in. Oh, that was just a technical thing, so don't worry about that. That's just a grammatical thing. 8, free distribution. Strike the language the same. Yeah, okay, so this is the coupon language. This coupon language is identical to 105 CMR 665. So it lays it out exactly how the state laws has, and I think you'll see by reading your language on the prohibition on coupons that there's nothing less strenuous. It's just as strict, this law, if not stricter. Sale of electronic cigarettes prohibited, Section 15. It just calls it what it is, electronic nicotine delivery devices. Let's see, everything with the following. Okay, just, I think, if I remember correctly, I'm not doing probably what you're doing, which is better, but I did it this morning, is looking at your reg. But if I remember correctly, this was lengthy. This was a lengthy section 15.1 because it was, you were in the front line, of dealing with, I think it was this public health emergency and that sort of
Yep.
thing. But that's come and gone, and so this is just shorter. Prohibiting smoking in workplaces, again, just substitutes acknowledging that you can't vape where you can't smoke, but they call it electronic nicotine delivery devices, just to make it clearer. And then section 17, violation of terms and permits. All right, so, this is the big, but this is the thing that kind of fixes it up. So 17.1, and of course, I will put this, I don't like doing it, but I'll do it. I always am looking for someone to help me out to actually integrate these with the document. I'll have to learn how to switch a PDF version to Microsoft. I'll have to learn, Tony will have to teach me how to not screw things up and make all the indentations screwed up, and it's not one of my fun things to do. If someone else ever wants to do it, I can just give them this, and then I'll read it. In any event, the first section would be 17.1, and that would entail, they mentioned, 6, 28, and 29, but they're basically everything that 105 CMR has. And this is going to indicate that all of the violations of state law, which are going to be incorporated in your local law, call for these state fines, $1,000 for first offense, $2,000 for second, and $5,000 for third. Now, a couple of things just to, kind of have you thinking about is, I noticed that I think, for the $1,000 one, 105 CMR 665 point, just to let you know, a quick history of this, it's .040, and it's entitled Requirements for Retail Establishments. And it goes on, A, B, and C, which, pretty straightforward things. But D was a little different. Funny thing is I had put together a lot of retailer statements to explain what the law was and what the violation repercussions were. And I had put $1,000 for a first offense, which was a huge jump of $100 to $200 to $300. This was for almost a year, I believe. And then someone, because we're always scouring over this, rereading it, and someone said this D, subsection D, says that the sale of a tobacco product by a retail establishment to a person under 21 shall result in the retail establishment being prohibited from selling tobacco products for up to 30 consecutive business days. Well, there was call the rest of us mostly, dummies, but we thought maybe the violations would be in the section that's entitled violations. So we went by that, and everything was along those lines. But someone said, well, what does that say? And that one just specifically talks about a violation of sale to underage. So it was, we got the Mass Municipal Association, and Mass Health Officer Association, and and the Mass Association of Health Boards. They all said, well, yeah, that's the meaning of that language, that there's a suspension of at least 1 day. Some boards have done that, and some have not. Most have not. I don't know. I think at the beginning it was felt a little bit of salt in the wound type of thing after, $1,000 fine. But that's your discretion. You'll have to make a decision as to whether in your regs, it's already in 105 CMR 665, and you already are authorized to, in fact, you are the only one authorized besides the Mass Department of Public Health to enforce it. So it's not a big decision, but if you literally put it in your regs, you can decide whether to put that suspension of a day or more for a first offense. And then after that, the other thing I wanted to address with you on this section was the wonderful questions of may and shall. It's a great thing to talk about with regs, but I think your regs, if I recall correctly, have may for your suspension levels, which, by the way, is similar to the state law. The state law says for a second offense it's 1 to 7 days. I believe 1 to 7 days, and the third offense is 7 to 30 days or 8 to 30 days. But it's may, and it's a range. You know, some boards of health, they just have a second offense is a 7-day suspension. You could alter that if you wanted, just since it's now $2,000 for the fine, and then $5,000. These are all things to just consider. They're all right here in there for you to consider. And then the second section would be what, 17.2? Yeah, 17.2, and that would be violations of other sections specific to just the town of Andover. So that's you have your cigar pricing, minimum pricing, you have, and actually this suggested 17.1 subsection 5 kind of just lists all of the policies that would fall under the 1,000, 2,000, 5,000, and the local ones which would fall under the 300, 300, 300, I believe is yours, right? It's for first, second, and third. I think you're straight 300. By the way, just, I'm sure you know, but the reason why it can't be over 300 is it's enforced by Chapter 40, Section 21D, which is the non-criminal disposition statute, which is like a parking ticket level there. Anything else, you got to kind of twist it and make it criminal, which we try to avoid. And that's, and then the last one here, Section 20, and is just, we did this with Andover. We just said, you adopted and hereby incorporate 105 CMR 665 as a local regulation. This was easier, this is easier to do than me literally putting some or all of every section of 105 CMR, and I would have spoken about 4 times as long than now. So, you know, we could put a few in. You know, some of the towns put in the flavored tobacco product ban and the nicotine level ban for 35 milligrams per milliliter for convenience stores and the like. But when I educate on 105 CMR 665. And the only other thing, I know we had talked about it before, Brian, but maybe might want to, even though the law has been around for a long time, ownership changes and such, and more of the communities in the collaborative now are using that statement that we have the retailer sign. It fits within your general rules and your permit. I don't know, I can't recall what section it is, but that says you know the law, you know the state and the federal law. Well, we just go one step further under that provision and just say, bullets, it's like about 12 bullets. I understand what an electronic nicotine delivery device is. I understand it even if it has CBD. It can have any substance. I understand that Zyn and On and other nicotine pouches may say they don't have any tobacco in them, but I know they're tobacco, and et cetera. It kind of gets a little in the minutia, but it's not minutia to a retailer who's in the business. And then they sign it. And I'm not one to have a, oh, here it is, you signed it, because it's not signing in ignorance. It's signing in just saying, I understand it, and that this is kind of adds to the solemnity, I guess, of running the business and selling a addictive product. Okay, that's it. I thought I was going to not. You almost lucked out. I forgot my glasses, so it's actually why I'm going to my. I remember being in this podium one time before, and I forgot my glasses, and I had to ask everyone what I was reading. I says, I know it's over here on the left-hand side, and it's in the middle. I didn't have to do that. I can get through.
I just want to say, just from my perspective, if no one else is, given the amount of material that and the complexity that could have ensued, you did a very effective job with this presentation and made me very comfortable with what you are proposing.
Thank you. And nothing snuck in. You know what I'm saying? That's what. No, I don't. You know what? I try never. Marion knows I'm not here to. I mean, I'm an advocate, obviously, for the program, but not for any policies. We don't want anything in. We don't want. We know you spent a lot of time on the regs, and so, and I'm going to tell you, there's a lot more that I could have done with them. But not everything to me. You don't have to do everything lock, stock, and barrel, especially. There's not a lot of high risk factor, and so I tend to be on the side of, believe it or not putting in as much. Just try to put in the essential, what I feel the essentials are. And then if you say, hey, someone over another town, they did okay, we can do that. You can have a meeting. And of course, I recommend a hearing. I don't know whether or not someone may want to come. If you certainly put one of the other novel, that you're considering one of the novel policies, then you'll get some really good attendance. And I'll just mention to you, you're the first I'll mention it to, but if there's even an interest in getting, I thought maybe what would be a nice idea, when you're bringing people to the board, sometimes it's like, oh boy, they're recommending this new policy, and I got to read the reg. What I kind of would, I don't know if it would be out of order or what have you, but I'd like to just invite the retailers to come in, see what they think of that LID, and get their input, and find out, you can hear it, and it could, because we're not trying to do it to penalize anyone. We're not trying to do it to make it difficult for them. Frankly, I'd like to just see a lot of zeros for my compliance check, so that's a little maybe selfish. Anything else?
Yeah.
Right.
She touched upon it earlier, but what's a ballpark estimate on what the scanning system
Yeah.
upgrades would cost? Whether it's just a small piece of hardware, some software, some IT time.
Yep.
What do you think? Did he give you any
He told me.
information?
He told me that the systems itself, the computers themselves, were about. Now you got to remember, this was probably, I think, 4 or 5 years ago. So
Yeah.
everything's gone. But he said they were around $1,500 a piece. He had
Okay.
1, 2, 3 of them. He had one at the deli and 2 at the register there. And then he told me an interest. Again, I'm not a tech person, but he said all scanners are not created equal. You got to get the good scanners.
Okay.
The good scanners, not the bad scanners. So the good scanners cost like around $250, $300 a
Okay,
piece.
so they're not buying a whole new POS system for the entire store for all of their everything for 15,000.
Yes.
Okay.
He was all excited about it too. He was showing it off to me. I mean, obviously he says, "Oh, I'll look on my phone and how many Marlboro cigarettes are on the shelf?" And it said 20, and and count them, 20. So it's good for inventory. He went to some
good.
onion rings. Some whatever, some snack, and he's showing me all.
Funyuns.
It's just everything. He was so excited about it. So I wish everybody was that excited about
All right.
it.
Are there grants?
Well,
I don't know. I mean, honestly, we could probably get some sort of grant funding to try to subsidize
yeah.
some of their
My
upgrades.
thinking was actually.
I
Or
mean-
see what people have today, like what is the gap?
Yeah.
I put in a pitch. I don't know. It's very difficult. There's a Juul settlement. I don't know if you heard about that, but we're going to get, I think, about $38 million over 4 years. And everyone has their own ideas of what to do with the money, of course.
Yep.
But I threw that idea as, why don't we, even if you give $500 or something, for someone in bona fide, they bought it, certified, I could see it and all that kind of thing. That's what the whole gist of the Juul settlement was, young people buying these vapes that they were, it wasn't they changed their tune afterwards, but that was too late when they, they had someone sounding like they were, my age, and I've been smoking, and now I went to Juul's. Like, yeah, but that wasn't what you were doing earlier on, so. But yeah, that to me would be right up, but I don't think that's going to happen.
I like that they're using it for alcohol and tobacco, though. I mean, it seems
Yeah.
like
Yeah,
it's a
right.
win-win for a retailer, right? To be able to cover both.
Oh, and yeah, I didn't mention the other downsides that I've had a few retailers really not like it at all. But they generally liberty interest and, not knowing what my name is and that sort of thing. And I get that. I mean, I guess everyone does. And their worries, of course, about what information is being read by the machine. It really is just, he showed it to me. I guess nothing's for sure, but I think that would cost a lot more money, and what would the retailer want with that? And I don't know all the laws, and I need to learn a little more about that, because that is something important. I mean, you do get to know someone's name, by looking at their card, if you look at their card. I don't even think it showed the address, if I remember correctly, although, again, it's on the card. So,
Nowadays, you have to show your ID to get cold medicine, so people are showing
Yes,
their
that's funny. That
all
came up.
over
We
the
talked
place.
about
So, I mean,
that.
it's becoming more
Yes.
norm than, it's not just,
I guess what I'm saying is, you might not agree with you might not agree with someone's view, but I know where they're coming from, and it's a legitimate thing to balance. But I think in the end, again, that's what you got to do. You got to weigh, and this is a pretty. If it worked, I mean, I wouldn't have to do well. I'd start focusing my compliance checks on other things. And my only wish list is I'd love to be. I told them I'd love to be an ambassador for our cessation department. So, you know, we set up the sign. What I would I tend to, when I'm at a store, I'll talk to customers. The retailer and I know we don't see eye to eye on maybe the product, but we get along. I mean, he's doing his job, she's doing her job, and I'm doing mine, and it's cordial. But what I would love to do is have business cards of some sort, and we have there's a 1-800-QUIT-NOW, and it's great. I mean, you can text. It's geared to youth, but to me, if I can hand someone a card, especially in a neighborhood, and say, hey, guess what? Judy Smith, the cessation specialist, she's going to be at the library, tomorrow. Oh, if you know anyone, your parents, your uncles, aunts, yourself, or whatever, it's free. They're doing, they're giving out nicotine substitute, nicotine patches. Make it, like, I don't know, more personal. And, I mean, I'm from a family of smokers, so that's how it worked. I mean, I think people said, oh, you got to go to Lawrence General, and, my mom went there, and my dad did another way. I guess, it's not a selfish reason, but I'd like to be known as something more than, the cop. No, I mean, really. I mean, it's the part I don't mind admitting I like the least, but I've done it for all these years. But I don't think that's the only way this whole thing works. Work on the demand side as well as the supply side. So.
I know we had talked about it. Are they required to have cessation products if they also sell, or no? Or was that just a conversation?
That was a conversation.
We
I tried
had-
to do
okay.
that in Andover. We had
Okay.
it's not my idea. The chairwoman, she said, can't we have a local law that says, for every display of products, X% has to be for the nicotine substitute. It's a freedom of speech thing. There's business speech, and you're forcing them to, and you're already forcing them with the warning labels, but, it gets to be a little difficult. So I like it. I like the idea.
Speaking of signage, did we ever figure out the 20% coverage rule on the warning on the signs?
Yes. Yeah. Well, first of all, I don't know who did it, because I don't think it was just me, but they're just magically all gone, unless you've seen them recently in North Andover.
I talked to the retailers.
Oh, so then that's why they're all gone.
Yeah.
I don't know. You should have told me the date, because I went to a few that I thought had them still.
No, Ron found in the FDA and
Yes.
the FDA settlements,
Yeah.
there was a clause in there that a retailer's sign for tobacco had to have a minimum of 20% coverage of the Surgeon General warning. 4 or 5 out of the retailers in town had signs that didn't match that. But their distributors give them to them, they just put them up.
Right.
So they got the triangles around the bollards, they got the big window signs.
Yep.
And he said that, and I was like, let me go take a look. And I drove around, and a bunch of the signs did not meet the FDA rules. So
You
I
didn't
went
even need to bring a tape measure, I bet, Brian, right?
no.
It's pretty obvious.
Pretty obvious.
Yeah,
You know,
fine print.
4x4 poster with a Surgeon General warning, 2x2 down on the corner. I'm like, yeah, that's not 20%. But the retailers didn't have a problem. And I said, hey, look,
Yeah.
there's a rule. I'm going to get more information on that. And I think you sent me something 2 years ago?
I sent you something.
Yeah.
It's not in your local regs, and then, I think they were, as I would expect, our retail community here in North End would be respectful of you, and knowing that it's a federal law, and that, if anyone was, particularly stubborn, that we'd have to report that to the FDA, and then they would enforce.
An FDA ruling or an FDA criteria in their
Yep.
settlement with the tobacco companies, right?
I believe so.
It was something very obscure
Yes.
like that, but I was like, oh, I didn't know that.
Yeah.
But, all right,
Yeah.
so that was solved, and that's legit, so I was right.
It is legit, yeah, you weren't just like showing your badge there, right, exactly.
All right,
No,
good.
that's true.
Any update on the Cumberland Farms lawsuit?
Which one?
They're
they've had a
suing
few.
somebody, correct?
Yeah. I should know the answer to this
Sounded
question.
like I've given an
It's,
update a while ago, but I'm just
it's
curious.
going to the Supreme Judicial Court.
Okay.
Oh, I know which one it is, yeah. Okay, what happened, if it's the one I think it is, because you gotta tell you, in honesty, I mean, at least on the local level, you don't have a Cumberland Farms here in North Andover.
No, we don't.
Right, yeah. But all the Cumberland Farms, the managers and the staff, I think very highly of. They're a professional company. They just seem to, whatever their higher echelon or maybe certain branches that were not within our collaborative, just kind of a little bit of, flexing muscle on both sides. I think this one has to do with they had a product. I think it was Black and Milds. You got to be easy on me. My details are really sparse on this, but I think the gist of it is there was a store somewhere in southern Mass where they were on the shelves, a banned product, so they were fined, and I think there was a suspension. And the Cumberland Farms' argument was they were on the shelf, but they weren't being sold. Now, the details that are very important were they still wrapped up? Or even if they weren't wrapped up, were any sold? I don't know. What it reminds me of a little bit of, meaning looking at both sides of it, is on one side, you have, hey, look, your Cumberland Farms, you should know what you're selling, and you shouldn't be putting something up there that's obviously flavored. The other side would be, would it be a factual dispute as to whether or not it was there by accident? Meaning, I'm not positive, but I don't think this one was a product that was labeled mango or, lemon or something like that. But we had the one that was the Jazz, which we learned was flavored. I don't know if they were Jazz. I'm going to flunk on this one. But the bottom line would be, did the Board of Health have the authority to fine and/or suspend?
Because it was on the shelf and it wasn't.
Because it was on the shelf.
Now it's my next
And
question.
then even a little more deeply, which is why it really is kind of making me dizzy, is it has to do with ability to fine versus ability to suspend, and what the amount of the fine was, and maybe a little bit of this mix of what we're talking about, what's a state law versus a local law, and that sort of thing. So they're having fun. We'll find out.
Fun, yeah.
They'll do the usual duking it out.
But that leads me to, do we have anything in here, or could we put something in here that has a fine for something being on the shelf versus a sale to a minor? Or is that moving it to a different section?
Yeah, there's model regulation.
that?
There is, that language is in there. That would be like, instead of just saying the sale of flavored tobacco product is prohibited, it would say the sale or possession of flavored tobacco product. I think it's fine to put the possession in it. I guess this was a little tricky at the beginning when folks had their product, they had to take it off the shelves. They had it maybe in the back room, and once again, it's this interpretation of, well, what's it in the back room for? You're running over there to get it. I like to think of half glass full, not half empty. I don't think for most it was that case at all. I think it was they're waiting for the distributor to get it, and that's where they're going to put it. And but then as months and months went by, and a year, it's like, okay, you got to kind of move it along, and bring it to your New Hampshire store, or what have you. But yeah, you can put that in. The other thing, though, is I've never had any problem. Maybe this is just reason I struggle with the answer a little is if it's on the shelf, you're offering it for sale. So
Correct.
To me, that is the same. But if it helps, to put possession in, sure, you could do that.
Just a thought.
Yeah,
It's like it covers you.
that's easy.
Any kind of.
And we had a, sadly, we've had a sale sometimes of the high-test vapes. I know you've prohibited the vapes except for in one adult-only tobacco store, which you don't have right now. And are you at your cap? I think you
We're
are
at
at your cap.
Yep.
So if you do that attrition clause, it would stay as it is, and the only way that, I'm not saying this in any way to, I don't know if there's I have no idea if there's anything in the pipeline. This isn't to frustrate somebody that wants to set up a smoke shop or what have you in North Andover, but if you were to do that, it couldn't happen unless something that you have now was converted and sold or either converted or sold and converted into a adult-only tobacco store. But yeah, sometimes we, sadly, it doesn't happen often, but we get reports that there are sales of the higher level vape products. Which, by the way, I think Europe, we say that you can sell 35 milligrams per milliliter or under, and then if it's over 35 milligrams per milliliter, then it can be sold in an adult-only tobacco store only. But I think in Europe, I got an email from the epidemiologist. In the European Union, it's like, I want to say 25. So and I think they still allow flavors, if I recall correctly, but they're very cognizant of the fact of how addictive the drug is. And then it's like the conversation we used to have about, and I think there still is sometimes, about lowering the nicotine or weaning folks off them a bit by lowering the nicotine level in the cigarettes. I don't know where that's gone. I haven't kept track of that. It's a good idea, though, I think. Except for the ban, except for the contract, well, if you bring them too low, then, there'll be someone else. It's got to be on the federal level, so there's always same with the Newports, so. All right.
All right.
Thanks for all that time. I really appreciate it.
No, thanks for coming on. I
All
appreciate
right.
it.
Very welcome. So if you have any questions or anything like that, just let me know.
Will do.
All right. Take care.
Thanks.
You too.
Thank you.
Thank you.
Awesome.
So do we need to discuss any of these, or is the plan to then have a hearing next time? What are your
Yeah, we
thoughts?
would advertise it. We would send out a notice to the retailers. We would give them time to come in and look at the regulations. So it wouldn't be a quick process.
Yep.
Because this is something that we don't want to try to ram through without anybody knowing.
Right.
So legal ad, notice to retailers, time to review and call with questions, public hearing, and then the next hearing, we would close it and pass it, any minor revisions.
So do we need to talk today about anything to help you prepare for that, like the mays or shalls, or the,
I would say take
or
some
the
time,
addition one? Okay.
read these,
Talk
take
about
a look
it
at
next
them.
time. Okay,
Yeah,
okay.
take an hour tobacco, I think we're good. No, Ron does a great job. I'm glad he is on board
Yeah, no, that was
and
great.
helping us out with all the tobacco stuff, because there's a lot going on. Just lawsuits and change in the industry, and the next generation thing is a big one. That's cutting edge, but a lot of people have a hard time with it. So a few towns have passed it. It has been appealed. It went to the Mass Supreme Court. It was upheld that a Board of Health can do that. So that was, I didn't know if that was going to pass or not, but it actually did. So on to general updates.
Sure.
So nominations. Next month, I think, whenever we meet again, nominations for board positions, because Michelle's tired of being chair. She got nominated in November of 22, so she's been on since January of 23. So, a couple of years.
Yeah, so if you guys think about if you want to nominate somebody or nominate yourself for any board,
If anybody wants to
Officer
step up and do
role.
it, just let us know.
we'll talk about it at the next meeting. We'll take so give you time to think about it. No official
Yep.
nominations. today.
Exactly. The intermunicipal agreement has been signed by the select board. We brought that to the select board last month. Signed, all the communities have signed it. It's been sent to the state, so we are in compliance with our grant, and we're still eligible for all our money. So it's going well. We actually, for the grant, I didn't have Annette come tonight. They worked at flu clinic this week on Tuesday, and
How did it go?
very well.
I was there.
Yeah.
Yeah.
Yeah. Do
Yeah.
you want to give us an update since you were there?
We had a good amount of walk-ins. We had a
good.
lot of people registered, and the majority showed up. And
Good.
there were a lot of families.
Excellent.
Yep. And we had pretty good amount that just came in and asked if they could get their flu shots. We had a couple of high school kids who weren't quite 18, and we were like, sorry, dude, you need your parent.
Shouldn't that be 17?
I think it should, but it is 18,
I know.
unfortunately, because he
Yeah.
was 2 weeks out of his 18th birthday, and I
Oh my
said,
God.
I'm sorry.
Come back to the office in 2 weeks.
Yeah. Or if your parents registered you online, that's
Yep.
the consent, and they could have walked in.
Yep. No, thanks for helping out. That was awesome.
Yeah.
I talked to Callan about it, and I got stuck in a meeting until almost 6 o'clock.
Yeah,
I was burnt at that point.
yeah, sorry. I just sat in the front and, you know, Officer Scarlett came in. Her
Oh, yeah,
first
that's
visit
right.
out after
Yeah,
her
Officer
surgery.
Scarlett
Yeah.
makes everything better.
Yes.
Would've gotten 8
Yep.
times the people.
A lot of
Everyone would've checked to see
screaming,
how she's
crying from the
Mhm.
kids, but,
Awesome.
yeah. It
Um,
wasn't bad. I mean, there were some kids that walked in, you could hear others crying, and they were like, oh, no. But overall, the majority did well.
Oh, good,
Yeah.
great.
Yeah.
Awesome. Along with the grant as well, they are making an offer to a person for a health communication specialist to round out our complete open position market for the grant. We do have an offer that's been accepted for the health admin position. An offer was just drafted up today for the health inspector position, so that should be going out in the mail tomorrow. So we expect to have him onboarded in the very near future. So we'll be back up to full staff.
Good.
Amazing. So I'm really looking forward to that, trust me. Last thing is, I think we should do something for our ex-chair, Joe McCarthy. When he's gonna be back East Coast, we should have him come to a meeting, plaque, recognition.
Can we do a roast?
Yes. He would actually love it.
Yeah.
Not on camera.
You know.
So any ideas or any thoughts on that? Let's kind of brainstorm over the next month or two. And when he comes back this way, we'll have him in and we'll take him out.
How many years was Tony in?
Tony was here for 5 years. So she's with the DPW now, so I still see her on a regular basis. She's actually helping out in the meantime between her leaving and Jen starting, and she can help train Jen as well.
Awesome.
It's funny because when she started, everything was on like paper, paper permits, paper checks, everything like that. Now everything's moved to digital. So when I trained her, it was a completely different system. I'm like, I don't know how to do it, like deposits anymore at this point. So she's gonna help train her and me
Great.
on the new system. But yeah, all our permitting is now online, everything. Plan reviews, submittals, payments. So we're actually stepped up and moved into the 21st century. And that's all that I have for now.
Any other discussion, questions from anyone?
Any
No.
rooster updates? You all good with the rooster stuff?
Yeah. I see this.
That was.
Yes, I have a draft. I'm probably gonna wait until the spring. I mean, now people are closing their windows and probably not hearing them as much, but I think we're gonna send that out to social media and to our animal permit owners, at least. Give them a heads up. We're dealing with 2 rooster complaints right now. And one we had at the board meeting, and there's another one, they have a deadline tomorrow of getting rid of the rooster.
Wow.
Surprising they're common, very common.
Is it?
Yeah. Like more
You
than
just
you would
don't
think.
Apparently you don't, when you get them, it's very difficult to tell when
Yes.
they're chicks.
Yep. And they grow up and they.
Maybe I'm just, in my head is emblazoned, salmonella, salmonella. Chicken, salmonella.
Yep.
Okay, well, if nothing else, I'll take a motion to adjourn.
Motion?
Okay. I'll motion that we adjourn.
Second.
All those in favor of adjourning?
All right.
Aye.
We are officially adjourned.